Hello, my name is Kovaltseva Irina Viktorovna. I am engaged in the teaching of urological issues, complex urological issues. But today I want to talk to you, not about complex cases in urology, but about a topic that I am actually asked at an appointment. This question is asked quite often, especially by younger patients. And the question is this: why is the penis sometimes curved, and when is it a disease, and when is it not? Tell me, please, has anyone ever seen a perfectly straight penis? If so, please write about it in the comments. Especially please write in the comments, those of you who really have a penis as straight as a thought. By fate, I have been in urology since I was 15 years old. That's just how my profession turned out, that I deal with penises. Of course, I've seen many, but in a non-erect state since I am a doctor. But sometimes during appointments, and female doctors, urologists will understand me, an erection still happens. When taking samples from the penis, during palpation or of the scrotum, patients can involuntarily respond with an erection anyway. So, since I've been in urology for a very long time, over 20 years probably, aside from me, very few people see as many penises. I understand that there are women in other professions who see even more because of their line of work, but I think even male urologists haven't seen as many penises as I have. So, authoritatively speaking, I can tell you that I have never seen a perfectly straight penis in my life. Why? Because there are different types of curvature. And with different pathologies, penises bend in different ways. There are cases of penile curvature. Some are related to disease and some are not. They are not related to disease, but to another interesting topic that I will talk about later. So regarding penile disease, curvature is often associated with a short frenulum, most commonly. This is when the glans bends backward. During an erection, the frenulum gets stretched and the penis bends downward, so to speak. This can be operated on. Surgery for this is simple and easy. And here is my medical, one could even say maternal advice to you. And don't overthink it, guys. Just get the surgery. The operation is simple, quick, and painless. It heals completely within a week. After a month, you can resume an active sex life. Complications are extremely rare and minor. Only in particularly severe patients who always seem to have some kind of complication with everything. Even for them, the complications here will be minor. This is one of the curvatures. A curved penis can also occur with a condition like this. It's called Peyronie's disease. This is a very interesting disease. I'll make a separate video about it. A separate video. At one time, this disease was considered a curse. All the great doctors have described it. Avicenna, Hippocrates, and even a royal urologist surgeon at the court of King Louis described it so thoroughly that the disease was later named after him, Peyronie. Peyronie's disease. It's a serious condition. I'll talk about it another time. And then there's the so-called vibe penis. It bends. Why do you think that is? Does anyone have any idea at all? The penis bends during masturbation. Because from an early age, around 10 or 12 years old, depending on the case, boys start to masturbate. They masturbate quite often, by the age of 16, several times a day. And it's always with one hand because sexual behavior is very psychologically determined and strictly established. In addition to urology, I also have a background in psychology and psychotherapy. And this topic is well known. It's hard to switch hands. The nature of arousal changes. That's why it's always the same hand, and the penis bends in that direction. The hand, in a way, shows which direction, which hand a person uses more. This is convenient for employers when hiring. If you want a left-hander, it's enough, especially in summer. It's very convenient, it's handy, and it's a cute trick you can use during a summer walk. If someone is interested, you can learn a lot about a person this way. But it's never quite the same as with the penis. If there isn't compulsive masturbation, then, as a rule, there isn't such a pathological peculiarity. Pathological severe compulsive behavior can occur in some mentally ill individuals, such as patients with Down syndrome, when they simply never take their hand out of their pocket. They have an increased sexual drive, which is connected on one hand to high anxiety, and on the other to disinhibition of the psyche. This is how they calm themselves, and this masturbation is constant and doesn't stop. They experience strong urges, they can't lead a sexual life. But as evolution shows, being bent over and masturbating the penis completely prevents one from having a sexual life. If it gets in the way, then the position is simply adjusted. Let me tell you a story that happened during one of my consultations. A boy came to see me. Very often young people come to see me, around 18 or 19 years old, who are just starting to have a sexual life. They come and ask me questions like experienced women would. They ask about size, whether things are normal or unusual in their country. Like, I have some kind of rash here and this, and how does this look here? All of this And these smart young people usually come prepared. Sometimes I have guys who come in with a list and ask 7 or 8 questions that have been bothering them. And that's how my consultations go. Sometimes it happens that I don't want a certain girl. Everyone wants her, everyone loves her, and anyone can approach her and have a relationship with her. I could do it too, but I just don't want to, that's all. In that case, I don't get an erection. Maybe I have a potency problem. For example, I once had a young man like that, a very young one. And young people often come in with curvature issues. Older guys don't come in. Older guys usually come in because of rashes on the glands which they think is a disease. In reality, these are just normal glands. I'll make a video about this, a separate video. But young boys, they're the ones who come in, and it's about this curvature. Usually they bring a photo of the head of the penis and say, here's the kind of curvature I have. If you want to get a consultation about this, you'll need a photo of the penis in 2 or 3 projections, so it's clear what kind of curvature it is. And then it will be clear whether this is a pathology, a normal variant, and what it's related to. Give me a like. Please, it's important. You could say that a curved penis, like any problem in a person's life, can either become your misfortune and somehow interfere with your life, or it can become an interesting way to use it. Because if the direction of the curvature of the glands hits the right spot, the G-spot, which is located in the vagina on the anterior wall under the bladder, that's where the G-spot is, the point of greatest sexual sensation in women. It's the only sensitive area in the vagina. There's no other sensitivity there. Even surgeries are performed painlessly in the vagina because there are no nerve endings there. It may seem like this area is well innervated. No, there are no nerve endings there. Only the G-spot and only the cervix. Everything else is painless. That's why the G-spot can be felt. And if during thrusting the curvature happens to hit that spot, it can be used in a very interesting way in your sex life.